A patient today asked about anxiety, and I mentioned as we were talking about anxiety that a certain amount of anxiety is actually a good thing. And they looked a little bit perplexed when we were talking about this, but I said, no, it really actually is. Let's say that someone has a big test the next day. They're a student and they have a big final in the morning. Anxiety could motivate that individual to sit down and study. It could motivate them to wake up at a reasonable hour and get to the library, or to stay up a little bit later than usual. Anxiety at work, for example, if you have a big presentation or something that you really need to do, it could cause you to work on that presentation, to take it really seriously, to make sure that you dress the part before you give that presentation and you're ready to go when it's time for that presentation. However, as performance increases, right? So as anxiety increases, performance actually increases, but then you hit a certain point where you might actually start to lose sleep. You might actually start to blank out when you're trying to do work or trying to think about something that you need to remember on a test or discussing in a presentation. You might start trembling in terms of your voice, or you might have other symptoms or other effects of that anxiety that cause you to be paralyzed or to not be able to get out of bed in the morning or do the things that you need to do. And so there's a certain amount of optimal anxiety. And if you have that normal, healthy amount of anxiety, there's certainly no need to treat it. There's no need to go on a medication for that anxiety. And it's important to note that, right? But if the anxiety is causing you a great deal of distress, we're unable to do the things that you normally can do, you're unable to enjoy the things that you normally enjoy, you're unable to be present with family, or you're unable to actually do the work that you need to do, or feel motivated to do it because of that stress, then that's when you would talk to a mental health professional and talk about non-pharmacological treatment options, and if severe enough, pharmacological treatment options. If you feel this video pertains to you in any way, be sure to reach out to a mental health professional to set up an appointment and discuss options.